Well, Duncan, thank you very much for taking the questions and for being part of our conference today. It was really important to hear from you, and we really appreciate it. I have a couple of short questions, and the first one relates to the health checks. And actually, the reason I'm asking this one is I just did mine. So I have some personal experience. And I know they've been getting a bit of a hard time in the media over the last week, and my experience was that I had to take really a couple of half mornings off work for the blood test and then for going back. So it made me think about those people that we really would like to do their health checks, and they're not the worried well. They're people who might really not be bothered to take those 2 half days. What's your thinking about the future of health checks?
It's a preventative measure, and it's about reaching everyone, so they're hard to reach, as well as those like yourself who you may be surprised at what you find out. And there's nothing remarkable about any of the components of the health check, and there's nothing that we need to be apologising for about the importance of checking blood pressure and cholesterol levels and how much you're drinking, and these are all things that are evidence. What we've never done before anywhere in the world is combine them and then say that, well, everyone should have the opportunity of having these things checked. I haven't yet had my health check. I wouldn't imagine I'd be too chuffed if it took me 2 half days. So I think that there's lots of learning to be had about what works. I think we should be completely open to who's doing these checks. Particularly, I think pharmacy have got a big part to play, but so do supermarkets and big football stadiums, and voluntary organisations who are in touch with the statutory services. When we think of them, we think of doctors and nurses. Don't get close to. So I'm thinking about faith groups and wonderful organisations like Age UK and the British Red Cross. So local government have been given this responsibility to reach the people, and they'll be thinking very hard about how to best do that, and we'll be working with them and sharing the learning. We recognise absolutely that the evidence isn't there entirely, but there is sufficient evidence, and there's certainly the evidence about the individual parts, that we should be continuing with this programme. It's also, I think, quite interesting that if it's about prevention, people are anxious, where's the evidence? But there's a great deal that we do in health care that hasn't been subject to the same test. So it's all part of this shift to getting in a bit early and to taking the action before it all goes terribly wrong. Because 2 half days of your time is better than a lifetime of the consequence of not knowing what your blood pressure is.
A question that I've been pondering a bit is about what's the right balance between the nudge approach to public health and the shove approach, the sort of legislative, come on, let's move that forward?
I think that's a great question, and there is definitely a balance. So neither can say it's not for me or it's all for you. There are definitely actions that are reserved to government, and these are being argued about, have been over many, many years, and you've heard me say in other places that the things that have really made the hugest difference when it's needed national action have always taken time, and they've taken longer than the professionals would wish. But we get there, and I'm very confident that that's what we'll get. We will get there for the next step about tobacco control, the next step about alcohol. There's more to be done, certainly nationally, and I'm completely cognizant of why that matters. There's also a huge amount, and even more, that we can do locally, and that is all about people and place and where they live, and creating communities where people want to live and bring up families, and where they can lead the lives that they want for themselves and for the people that they love. And those are things that it's all about local. So the balance is what can government do that creates the environment for what people locally can then get on and make sense of. If you try and direct that from afar, you never get the priorities quite right, and you're never as ambitious. So I think it is about the balance. Is that emphatic enough? I'm very, very clear that we cannot make the next big steps forward in improving the nation's health without national action. But it's not all that matters.
I think that's very helpful, Duncan, and I think those of us in the area of improving public health will get frustrated from time to time at what we think is exasperated really at what we think is inaction to the obvious. Why don't they just do it? But I think you're right that it will happen, and it takes its time through the political process, and so we'll be optimistic that something will happen soon.
I think the political process is a process of engaging people. It's the 100,000 voices that will make the politics of this work. Politicians are listening more, often more, to what the people are thinking than the professionals. So a bit of humility and recognising that laws are there by consent. And being right and saying the evidence says is often not sufficient. People have to believe, and that comes from, as I say, 100,000 voices, not just from the evidence.
We talked a little bit and a couple of times at the conference about movements, and that seems to be what you're saying in relation to getting the movement and the population swell behind an idea. From probably more of an RSPH question, really, is about the wider workforce development, which, as you know, that we've been pioneering and are really interested in, because we think it's doing things differently and measuring it and seeing what can happen if you actually provide education and support to people working on the ground in these areas. What do you think Public Health England can do to help move that along?
Well, listen to you. You have the most precious and rich contribution over many, many years. What more, or what could be more important than investing in people and giving them the skills and the qualifications, the recognition that goes with the learning, and to create not a workforce of 10,000, but one of 10 million, and reaching to all the people, and to say, well, you're involved in public health work. You may be the souls that are putting the insulation into the lofts of the homes of the elderly, or you might be next to a school on a busy road helping the children to get across the road. I mean, we know of the work that you do with the food and drinks industry and the occupational health industry and in workplaces. So I think Public Health England, and I know you know this, want to engage you fully in what we mean by workforce development, and to the importance of the professionals, but the importance of the wider community that have something to offer, and that the Royal Society is already in touch with much of those people. So I am. Public Health England isn't of its. We don't own. We join in and share the responsibility for improving the nation's health, but we do have. We have the particular responsibility to convene and to influence, so we can bring together people. And I don't think it's about Public Health England saying this is what we think. It may be, though, Public Health England saying, listen to the Royal Society.